Good afternoon, everyone, or good evening. You can say good evening also. Today we are going to learn about the inflammation or infection of the eyelid. So first of all, we should know what's eyelid. Here we can see the first image. This is known as eyelid, and these are the eyelashes. So any infection or inflammation that occurs in this part of the eye is known as eyelid or eyelash infection. Commonly, there are two infections that occurs in this part. One is Stye and another is Chalazion. I have highlighted here Stye and Chalazion. Others are molluscan contagiosum, herpes zoster ophthalmicus, herpes infection from the lid and cornea. So first of all, I know you people are not that much well known about the Stye and Chalazion. So first of all, I am going to show you some images. The first image, you can see in the first image. Here we have shown Stye, and here we have shown Chalazion. In the second image, you can see here there is a red bump which is near to the eyelid margin or eyelash. And in the third image also here is yellow that means pus has started forming, and it is near the eyelid margin or on the eyelash. So these are Stye. But there are other differentiating points which will be learn later on. As in here, fourth image, you can see here a large bump is there. This is a bit above the upper eye lid margin and this eyelash. In the fourth image, you can see here a bump in the lower eyelid, a bit away from the lower eyelid margin and the lashes. So these are Chalazion. So for better understanding, we'll go on reading the Stye and Chalazion, which are most commonly found infection of the eyelid. Other we can go through here. So Stye, you can say that the Stye is the suppurative inflammation of the lash follicle and its associated glands or gist. And you can see here the same image is shown that we have seen above. Now we know about the pathogenesis. Pathogenesis means how this occurs, how inflammation occurs. So in the gland or gist or eyelash follicle is infected by Staphylococcus aureus, or any Staphylococcus species, can say about it, Staphylococcus. Then causes localized acute inflammation, which ultimately cause an abscess, and this abscess is formed near the base of the cilia. As we have written here, it is localized. But why localized? Because the bacteria produces coagulase enzyme. This coagulase enzyme, it doesn't let the infection to spread to the surrounding tissue, and causes, as it is confined to the space in which the infection has occurred, it causes severe stress on the cells that are surrounding, and also irritates the pain receptors and produces severe pain, redness, tenderness, edema, which are the signs of acute inflammation. So this is the pathogenesis of the Stye. From this pathogenesis, we can know about whole disease. So pathogenesis is needed to be understood. Now we will come here for incidence. Incidence is common amongst the young adult. but can occur in any age, especially in the diabetes mellitus or immunological compromised patients.
Now we'll know about the clinical feature. And simply clinical feature can be said from the pathology. Where it was occurring in the lid margin or base of the eyelid less. And it's suppurative, it's painful and tender, and along with this there is the abscess formation. So from this knowledge you can say the clinical feature. The patient who comes to you, he has pain and swelling in the lid margin, in the eye less. Yes. So you can say simply that there is a tender swelling in the lid margin, pain, and ultimately an abscess formed that burns near the base of one of the ceiling. So now we can go for treatment. And treatment you can simply categorize into two. It is before the formation of the pus. If someone comes to you with a red bump in the eyelash margin, eyelash base of the eyelash or lid margin, and you can simply give him the oral antibiotics and analgesic to reduce his pain. Analgesic, you can give him diclofenac. You can give him diclofenac twice daily or once according to the pain. And with this, you should give him PPI like pantoprazole or any other. Like you can give him better esomeprazole. The analgesic should be given after a meal, and this PPI should be given before meal. And oral antibiotics like can give amoxicillin or you can give him cephalosporins or tetracycline. So you can give him amoxicillin like amoxiclav, and which is a combination of amoxicillin and clavulanic acid, and cephalosporins and tetracycline. You should give antibiotics in the respective dose. Like you can give amoxiclav for 7 days, amoxiclav for 7 days, 3 times daily after meal. And with that analgesics like diclofenac twice daily or 1 time daily after meal during the pain. And with that you should with analgesic you should add a PPI like esomeprazole or once or twice daily. If analgesic is given twice daily, then esomeprazole also twice daily before meal in empty stomach. Then if the patient comes after pus formation, then epilation of the associated lash and evacuation of pus. The lash should be taken, the single lash where the infection has occurred, it should be taken off, and the evacuation should be done of the pus. Pus can be set for CS, and if antibiotic should be given, and if needed, then